this is more so of the private area. When you're doing your palpations on a patient, make sure that you let them know where you're palpating and that you may or you may not expose some of their body parts, just so that way they are comfortable and they can't say that you try to do XYZ to them. So we're going to start up here at the hip on the lateral side. And we're going to feel for the head of the femur. So right here where the hip joint is, I'm going to press into it. And we're going to move your thigh side to side. And you can feel the head of the femur pop in and out, rotate. So when the femur is rotated out, you can feel the head of it more better. So right there, you should be able to feel the greater trochanter. The greater trochanter, which is sticking out right here. You'll feel a groove, and that's where the greater trochanter is. So also, staying on the anterior side portion of the pelvic, we're going to palpate the anterior superior iliac spine and the anterior inferior iliac spine. So starting on the anterior part, we're going to press down, and right there you should be able to feel the crest of the iliac. Should be the first thing. This is where your hip and your stomach line, where you try to get the V in your abs. That's where you're going to feel your iliac spine, the top of it. So you'll feel the iliac spine first, and then if you go inside, right here is the iliac fossa. So coming back on the spine, if you move down, you'll palpate until you get to this notch. This notch right here is going to be the anterior superior iliac spine. That is what is right here at first. That's what you're going to feel coming down the crest of the iliac. You'll keep on palpating down, and the first notch that you feel is going to be the anterior superior iliac crest. So you're going to palpate a little bit further down, and right here at the second notch, that's what you'll feel. You will be at the anterior inferior iliac spine. So up here is the anterior. Above it is the anterior superior iliac spine, and palpating down, you will get the anterior inferior iliac spine. So we're going to have the patient move downward. So now we're going to palpate the abductor muscles. Push the camera back. So you can put your fist between the legs and have them squeeze. And when they squeeze, you're actually feeling your abductor muscles right here on them. So have them squeeze again. Squeeze your hands in between their legs, and then you can palpate. You can actually feel as soon as they squeeze it, their abductors muscles being engaged. So you can take one fist out and put it in there, and you can actually palpate the sides, the insides of the sides of the legs their abductor muscles, and then continue squeezing. And you can just feel them on the sides coming down. So next, after that, you're probably gonna have to flex this again to feel the vectus, the vectus medialis muscle. You're gonna have them flex their quad muscles. So right here, you have the vectus medialis muscle that's right here. And in the middle, you have the rectus femoris. And on the lateral side, you have the vectus lateralis. The vectus muscle has two parts to it. On the lateral side, you have the vectus lateralis muscle. And then right here on the medial side, the inside, you have the vectus medialis. And in the between them, you have the rectus femoris muscle. Should have kept your pants off and could have saw it better. So again, to palpate the vectus medialis, have your patient flex their quad muscles, and if they have great definition, which you can't see with the tights on, but as you palpate down the medial side of the thigh, you can feel that muscle right here, and that's going to be your vectus medialis. And then the next muscle next to it going lateral, you will feel the rectus femoris. And after the rectus femoris, you will feel on the lateral side the vectus lateralis muscle on the lateral side. So vectus lateralis, and then your rectus femoris in the middle, and then your medial, and then your vectus medialis. So again, if their leg is defined, which you cannot see under these tights, but his definition you'll be able to see, and you'll see where the muscles are actually notated in the legs. So next we're going to have the patient lay on their stomach. Where are you gonna hold it? Can you see it? I'm talking about your back. Okay. So, as the patient lays on their stomach, we're going to palpate where the sacrum and the L5 meet. The L5 vertebrae meets. So, So, as you press your hand on the superior part of the buttocks, what you would consider the buttocks, right here, like where their butthole is, above it, you'll feel right here where the sacrum would be is like a large palate bone that's right here. And so above it, you will feel a spine sticking out, and right above it, that would be the L5 vertebrae. And in between it, you can feel a space between the sacrum and the L5 where they meet. in this space right above it, between them, you will feel the joint, the sacroiliac joint that is between the sacrum, which is right here. Then you have the joint, which is the space, and that'll be the sacroiliac joint. And right above it, you'll have the L5 of the vertebrae, all right here. And this is all on the lower back. So you put your hand right above on the buttocks, like above where the butthole is, and you will feel this pallet of bone that is together. And right there, that's where you will find the sacrum. And where the sacrum is, right above it, you will feel a space. No, you'll feel the spine of the L5. And that's where the L5 is in the sacrum. And right in between it is a joint right here. And you can feel where the sacrum iliac joint is. Right there. You will feel the gap between it. So next, when you're palpating the buttocks again, just think about where you actually sit. So like sitting on the floor and you're getting sore. So you'll feel for the ischium, and right there at the tip of it, you'll feel the ischium tuberosity. Just imagine you sitting on that where you actually sit, and that is where the tuberosity is, where you feel that pain, where you be like, ah, from sitting too long, and it'll be right here. So you will go on the buttocks and you will palpate till you get to the end, and you will feel the bone right here on the ischium, and that'll be the ischium tuberosity. And that's where you feel the pain from sitting down too long. Right there. Okay. So now we're going to feel for the semi-brandosis and the semi-demosis muscle. So we're going to have the patient flex their leg 90 degrees. And you're going to have their leg against your shoulder. Well, his is going to be against my shoulder because he's tall. And you're going to have them push against your shoulder. And you're going to palpate right here. You should be able to feel the muscles right away. On the lateral side is your biceps femoris. On the lateral side is the biceps femoris right here. The medial side, you feel two right here and right here. This one will be your semi-demosis, and right here will be your semi-brandosis muscle. And these three make up your hamstring. So right here is your bicep femoris on the lateral side, and on the medial side, you will feel two muscles. On the bottom part, more medially, you'll feel the semi-denonosis muscle, and right above it, you will feel the semi-brandosis muscle. And these three muscles make up your hamstring muscles on the back of your leg. So make sure you have them keep their leg at 90 degrees. Tell them to push up against your body, and they'll flex their muscles. And on the lateral side, you'll feel your biceps femoris muscle. On the medial side is your two muscles, and you will palpate and you will find two. The one that's more medial on the bottom side is your semi-demosis. The one that's more on top is your semi-brandosis. Okay, so we're going to have the patient. So next we're going to palpate the sartorius muscle of the put the other leg over the other one. So for this demonstration, we have the right leg, no, we have the left leg stretch out, and then we have the right leg crossing over to the left. So we're gonna push down a little bit, apply some pressure onto the right leg, and then we're gonna palpate coming from the lateral side of the hip on top of the thigh, and you're going to palpate down, coming down medially into the leg, and you will feel the sartorius muscle all the way down to the knee. So you palpate the medial side of the leg going up to the lateral side of your leg, you will feel the sartorius muscle. Applying the pressure to flex the muscle, you will feel the sartorius muscle.